1. Your patient's end-tidal CO2 after anesthesia induction is observed to be noticeably elevated despite enhanced minute ventilation. What do you do if your diagnosis is as suspected? A. Give bolus of something. B. Give dantrolene and abort case. C. Suction airway. D. Increase tidal volume. Two, you are looking at a 34-year-old, 100-pound patient who has just been admitted. Both of her arms and her entire back, from the neck to the buttocks, are burned. What IV fluids will be prescribed in your entrance orders? A. 10.8 liters of fluid, with 5.4 liters were placed in the first 8 hours from the time of burn and 5.4 over the next 16 hours. B. 5.4 liters of fluid, with 2.7 liters were placed in first 12 hours from now and 2.7 L over the next 12 hours. C. 10.8 liters of fluid, with 5.4 liters were placed in first 8 hours from now and 5.4 over the next 24 hours. D. 10.8 liters of fluid, with 5.4 liters were placed in first 8 hours from now and 5.4 over the next 16 hours. Three. The inhaled anesthetic you intend to employ has an extremely high MAC. High minimum alveolar concentration, MAC anesthetics typically. A. Less lipid soluble. B. Very slow onset. C. Little of it is needed for adequate anesthesia. D. More potent. 4. You are seeing a patient in the emergency department who banged his head after falling while skiing. He lost consciousness, according to his buddies who were with him, and they brought him to the lodge while dialing for an ambulance. He woke up on the ambulance ride to the hospital and briefly appeared to be fine, but he is now unconscious once more. Which vessel is typically at fault given the diagnosis you suspect? A. Middle meningeal artery. B. Basilar artery. C. Posterior meningeal artery. D. Anterior meningeal artery. Five. You are visiting a patient in the SICU whose attempt to wean off the ventilator has been unsuccessful for the previous 3 days. The patient has a history of trauma, is tube-fed, and has been on a ventilator for 10 days. To determine a respiratory quotient, RQ, you choose to order a metabolic cart. This patient has an RQ of 1.45. You tell the dietitian that the patient requires A. Increased amount of tube feeds overall. B. Reduced amount of fat in tube feeds. C. Reduced amount of protein in tube feeds. D. Reduced amount of tube feeds overall. Six. Treatment for a 38-year-old woman with primary Raynaud syndrome included calcium channel blockers and cold avoidance. She still has significant, refractory symptoms though. The distal second, third, and fourth digits of her left upper extremity were critically ischemic and ulcerated when she was recently admitted. With a wrist brachial index of 1.03, the palmar arch, radial, and ulnar pulses were all present. She had intravenous prostaglandin therapy, topical nitrates, and a heparin infusion as treatment. She gradually advanced, nevertheless, to the point where her second and third digits lost all of their tissue, necessitating a distal amputation. Which of the following approaches to this patient would be reasonable? A. Implanted catheter for continuous nitrate infusion. B. Upper extremity bypass graft. C. Cervical sympathectomy. D. Upper extremity angiogram with radial and ulnar stenting. Seven. A 70-year-old man arrives at the hospital after falling while hanging Christmas lights on his roof. He claims to be experiencing right-side chest pain and shortness of breath. His right breath sounds have significantly decreased, according to a physical examination. The moment you insert a chest tube on the right, 850 milliliters of blood start to flow back. Which course of action in his management is best? A. OR for operative exploration. B. Keep tube to suction, watch pressures and output. C. Remove chest tube and place dressing. D. Suction then remove and seal chest tube site. Eight. A dental operation is being performed on a 45-year-old male who had a prosthetic aortic valve replaced 5 years prior. Given its better absorption, which preventive antibiotics are advised? A. IV penicillin. B. IV ampicillin. C. Oral vancomycin. D. Oral amoxicillin. Nine. A 73-year-old man who has a history of atrial fibrillation and hypertension appears with mid-abdominal pain that started out of nowhere. A little while afterwards, I had a black, liquid bowel movement. There are no signs of peritonitis on an abdominal exam. The patient does, however, have leukocytosis. He is brought into the surgery room to be examined. The ascending colon, cecum, and distal small bowel appear dark and purple. What will management do next? A. Warm the bowel and reevaluate in 24 hours. B. Revascularization followed by bowel resection. C. Systemic heparinization. D. Bowel resection and anastomosis. Ten. Which of the following statements about the lymphatic drainage of the lungs is true? A. Flow of lymph from the left lower lobe may drain to the right mediastinal, paratracheal lymph nodes. B. The upper 2/3 of each lung drains to the hilum, while the bottom 1/3 drains below the diaphragm. C. The thymus gland drains the anterior portions of both lungs. D. The thoracic duct picks up tributaries along its route through the mediastinum, providing most of the drainage of the left lung. 11. A 59-year-old man who has a slight fullness behind his right knee but no pain or restrictions in knee motion presents. He smokes 30 packs a year, consumes 1 to 2 beers socially each year, and takes hydrochlorothiazide to control his hypertension. He was examined because of a noticeable popliteal pulse, and duplex ultrasonography revealed a 3.4 cm popliteal aneurysm. His left lower extremity pulses are normal, as are the femoral and distal pulses on his right leg. The best course of action for management would be A. Abdominal ultrasound. B. Open aneurysmal exclusion with bypass. C. Surveillance duplex ultrasonography in 1 year. D. Endovascular popliteal artery stent placement. 12. An 82-year-old woman presents with postprandial dull abdomen pain that has been present for almost a year. She dropped 25 pounds in the previous 3 months as a result of avoiding oral intake due to worsening discomfort symptoms. Her symptoms have not improved after repeated normal upper endoscopies and long-term proton pump inhibitor medication. She underwent a laparoscopic cholecystectomy 6 months earlier for several tiny gallstones, which were discovered during a right upper quadrant ultrasound. 4 months ago, a colonoscopy revealed a solitary, fully excised pedunculated tubular adenoma. A CT scan was conducted, and it reveals no indication of cancer, see below. The patient is cachectic upon examination. Her abdomen is soft and not painful to the touch, and no lumps are visible. An analysis of the lab results reveals microcytic anemia and an albumin level of 2.4. The most effective course of treatment for this patient would be A. Total parenteral nutrition. B. Selective angiography. C. High-dose migestrol acetate. D. Placement of a jejuna feeding tube. Which of the following statements about a tumor marker and the malignancy it is typically linked with is true? A. Carcinoembryonic antigen, CA, and melanoma. B. Alpha-fetoprotein and brain tumors. C. CA19-9 and pancreatic cancer. D. CA125 and thyroid cancer. What pulmonary function test is the most effective at predicting postoperative performance when lobectomy is being considered? A. Quantitative radionucleotide perfusion scanning. B. Gas exchange functions, such as DLCO, diffusion of carbon monoxide in the lung. C. Plain chest röntgenogram. D. Predicted postoperative forced expiratory volume FEV in 1 second FEV1. After an MVC, an ambulance transports a 43-year-old woman who has numerous left rib fractures and respiratory problems to the emergency department. She exhibits tachycardia, tachypnea, and hypoxia. Chest XR shows the tip of the NG tube in the left chest after an NG tube is inserted. Which statement about the issue with this patient is accurate? A. This injury occurs more commonly on the left side. B. Rib fractures can obscure NG location on XR and CT scan should be performed. C. NG tube is in the left airway and should be removed. D. NG tubes commonly puncture the esophagus if care is not taken in placement. A woman visits the emergency room 6 days after starting warfarin therapy with severe, black scars on her arm, breast, buttocks, and foot. Your presumed illness is probably caused by a lack in one of the following. A. Vitamin K. B. Vitamin C. C. Platelets. D. Protein C. A biological mechanism for each of the following bacteria's antibiotic resistance is correctly matched, with the exception of A. Vancomycin-resistant Enterococcus, mutation in penicillin-binding protein, PBP on the cell membrane. B. Gentamicin-resistant Enterococcus, mutation in penicillin-binding protein, PBP on the cell membrane. C. Carbapenem-resistant Klebsiella pneumonia, KPC, carbapenemase production. D. Methicillin-resistant Staph aureus, mutation in penicillin-binding protein, PBP on the cell membrane. Which statement about the renin-angiotensin system is true? A. Angiotensinogen is secreted by the kidney. B. ACE converts angiotensinogen to angiotensin 1. C. Renin stimulates the conversion from angiotensin 1 to angiotensin 2. D. Decreased renal perfusion stimulates renin production. Which of the following typically becomes severely depleted and is frequently administered after large and enormous blood transfusions? A. Calcium. B. Vitamin K. C. Potassium. D. Glucose. A 56-year-old guy who underwent a heart catheterization earlier in the day is brought to your attention. He expresses pain in the femoral region, site of procedure. A painful, pulsating lump is palpable, and ultrasound results support your probable diagnosis of pseudoaneurysm. The tumor had kept growing despite fruitless attempts to treat the compression of the ultrasonography probe and thrombin injection. What should we do next? A. Covered stent placement. B. Surgical ligation. C. Ultrasound probe compression. D. Ultrasound-guided thrombin injection. Chyle leaks are frequently treated by adding extra of the following fatty acids to the patient's diet. A. Short chain. B. Medium chain. C. Long chain. D. Very long chain. MBBS practice test. The MBBS, Bachelor of Medicine and Bachelor of Surgery, is an undergraduate medical degree that typically takes 5 years to complete. This degree is awarded by universities in countries following the UK medical education tradition. To earn an MBBS, students must pass entrance exams and qualify for medical school, after which they can choose to specialize in a particular field. Career options after MBBS. MBBS graduates can become doctors, a highly rewarding and well-paying profession. Other career paths include healthcare management, medical research, or entering fields like biotech investment banking. Government roles are also available through exams like the Combined Medical Services, CMS, specializations and alternative careers. Can pursue further specialization in fields such as surgery, pediatrics, or cardiology. Alternatively, they can enter non-clinical roles like medical research, healthcare consulting, or teaching. The degree also offers opportunities in emerging fields like medical technology, telemedicine, and integrative healthcare, broadening the scope for careers in both traditional and innovative areas of medicine.